So my name's Gail and I work in the IPU unit, which is the inpatient unit at St Columbus Hospice. So the inpatient unit basically provides two different strands of care. So that would be for somebody that comes in for symptom control management, so maybe people that are struggling with pain. So we'd bring them in for a short admission and maybe look at some of their symptoms, manage them, get a plan together, and once they're feeling a little bit better and more secure that they can go home, then we would discharge them home. The other strand of the work that we do would be for somebody that is heading towards their sort of final days or weeks of life, so end of life care we call it here, and that's people that need that extra level of support or expertise or palliative care. They have a need that can't be met in the community, so they would come to us and we would care for them here 24 hours a day. The most important aspect is the person-centred side of things. It's got to be treating every individual as the individual they are. We kind of have this mantra that you matter because you're you and you'll matter till the end of your life, and it's trying to achieve that and making sure that people do feel that they matter and that their individuality is respected, and also to have a good death. If somebody's had a good life, or whatever kind of life they've led, but they should have a good death as well, and that's very much our ethos as well. If we are getting patients for end-of-life care, or we want to try and create an environment where they have a good death, and that's really important to what we do. So usually what we do when patients come in, one of the first things we like to do is talk about their goals. Sometimes we'll have patients coming in and they do have a specific goal in mind. We've had quite a few people coming in that really want to get married, for example. So we would put things in place to try and make that happen. We have other patients that want to go to concerts. We've got other patients that want to have their cat visiting, or it could be something as simple as they really want to have a shower or a bath, and they've not been able to do that because they've just been too unwell. So any kind of goal that's important to that person, we try and make that happen, taking everything into account, and also that includes their family, their loved ones, whoever else that's important to that person. You know, when people come in to the inpatient unit, they're not restricted to being in the inpatient unit. So as you'll probably know, we have lots of different classes and things. They can go up the stairs to the classes, they can participate. We have many patients that do that. You can have day passes where you can go to something and then come back in again. That's all accessible as well. So it comes back to that holistic care of individual patients and what's important to them. I'm immensely proud of the work that we do. I'm so proud of my team. I'm really quite privileged to work with such a great mixture of people. There's a lot of personalities, but everybody brings something to the table, which I really like. There's a great ethos of teamwork here, and when you know that you've made a real difference to somebody's life, there's no better thing. There really isn't.